Hi, my name is Nicole Deladon, and I am presenting on Week 12's topic, which is mental health services. Using our textbook, along with the New York Times article titled New Rules Promise Better Mental Health Coverage by Robert Pear, I will be discussing the importance of mental health services, treatment options, barriers in accessing mental health care, and shifts in the mental health care system. Why the need for mental health services is so important. Mental health services are extremely important because so many people in the United States are suffering from mental illnesses. It has been estimated that 26.2% of Americans ages 18 and older, which is approximately 1 in 4 adults, suffers from a diagnosable mental disorder in a given year. That amounts to approximately 57.7 million people affected. A subgroup of people having a diagnosable mental illness is classified as having a serious mental illness, also known as SMI. Those within this group have at least one disorder that meets diagnostic criteria. This subgroup consists of 6% of adults in the United States and is viewed as being at greatest risk and having the greatest need for mental health services. Many people may be unaware of the extent of those affected by mental health disorders. Neuropsychiatric disorders are the leading cause of disability in the United States and Canada, surpassing cardiovascular disease and cancer. Currently, there are 17 diagnostic categories in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Health Disorders, also known as the DSM-4. Within these categories, there are specific diagnostic criteria for over 450 conditions. Having so many different diagnosable mental health disorders shows just how important having services to treat them are. According to the National Institute of Mental Health, nearly half of those with any psychiatric disorder meet criteria for 2 or more disorders. Now to discuss the treatment services available for those with mental health disorders. Out of the 45.6 million known to have a mental illness as of the year 2011, only 38.2% were able to access mental health treatment services. Those with serious mental illness are most often treated within the mental health sector. Others who are less severely afflicted receive services and treatment in other settings. Some of these other settings include treatment by psychiatrists, non-psychiatrists, general medical providers, human service providers, as well as alternative medical providers. There are many barriers in accessing mental health services for certain groups of people. Patients with a mental illness and a substance abuse disorder experience additional barriers due to the stigma associated with substance abuse. Substance abuse is a chronic brain disease like many other psychiatric disorders. However, the general community and many providers do not view this as a chronic illness, which impacts accessing care. Children and adolescents also experience some barriers. A survey was done in 1999 of children and adolescents between the ages of 9 and 17 with a diagnosis of mental disorder. Only 9% had been able to access and receive some mental health services, which accounted for less than half of those diagnosed. Diagnostic techniques have been highly refined over the years. However, research funding for treatment of mental illness in childhood and adolescence has not kept pace. The need for expanding the workforce, developing early interventions, and seeking enhanced funding for research is critical for this group. Older adults also experience some barriers. Many advances have been made in the treatment of mental disorders. However, a critical situation appears in providing behavioral health services to the older population. Studies have indicated that 1 in 4 older Americans have a significant psychiatric disorder, with depression and anxiety disorder being the most common. Assessment and accurate diagnosis is challenging within this population, limiting their access to many services. There have been shifts in the mental health system that are intended to increase access and quality of mental health coverage. Under the Affordable Care Act, The individual mandate of health insurance coverage must provide psychiatric and behavioral health benefits as well as provide for coverage equality. The ACA's targeted improvements of health outcomes through improved quality of care, efficiencies through accountable care organizations, as well as their integration and coordination of health services will benefit mental care. With the ACA's new provision for equal insurance coverage, newer models of care are emerging that emphasize the integration of behavioral health services with primary care. Behavioral health services becoming increasingly integrated with primary care services is beneficial in providing better health care for those with mental disorders. The article I chose, New Rules Promise Better Mental Health Coverage by Robert Pear, relates to the idea of shifts in the mental health system to increase access and quality of mental health coverage. The article mentions that the Obama administration issued new rules that promise to improve insurance coverage of mental health care for more than 140 million people insured through their jobs. Under these rules, employers and group health plans cannot provide less coverage for mental health care than for the treatment of physical conditions such as cancer and heart disease. Insurers also cannot set higher copayments and deductibles or stricter limits on treatment for mental illness and addiction disorders. Since disparities are common in the insurance industry, these rules will make it easier for people to obtain treatment for a wide range of conditions. Kathleen Sebelikis, a Secretary of Health and Human Services in Washington, mentioned that the rules guaranteed that people with debilitating mental disorders would not suffer needless or arbitrary limits on their care. These rules are likely to reduce disparities so more people will be treated by mental health professionals, which could lead to more appropriate care and better health outcomes. And these are my references.